Good evening, everyone. Good evening and welcome. Welcome again for another session with Sister to Sister Straight Up Real Talk. I am your co-host, Veronica Hardy, and along with me is my beautiful sister, Jacqueline Whitaker, who is also our co-host. And today we have a wonderful session awaiting for all of us. So please just come right on in and sit down as we wait to get ready to get started. We have so much that we need to discuss tonight, and we're excited about it. It's about bringing awareness. It's about things that needs to be spoken about, and we're loving it. We're gonna love it all, and I do feel that you all will like it as well. So as I'm looking today, this weekend, I'm saying, excuse me, today was a beautiful day. It was a day for us. It was beautiful in our area, in the north. Totally beautiful. I went on my walk. I enjoyed everything. Hey, Jack.
Hey, sis.
Hey, girl. Good to see you. You sound strong.
Yes,
And
yes,
the voice
yes.
is coming in strong. So I was just saying, we're looking for a wonderful time. Our weather was fantastic.
Yes.
Absolutely fantastic. And I went for my walk. I got up extremely early because I wanted to get everything done on our days that we prepare to do our sessions. It's always a very busy day for me. And I'm sure for you as well. So I got up early, went out for my walks, did whatever errands I needed to do, just to get myself going.
Yeah,
And,
very good.
yeah, get re-energized, try to get that fresh air in your body and just ready to go. So, yeah, so I'm feeling good. What about yourself?
Beautiful day today. Beautiful day today. I was with one of my friends and, we had breakfast together and it went very nice.
Good.
Yeah. And the weather's just beautiful out. Just beautiful.
Absolutely.
Yeah.
Yes. So as we get ready to prepare for tonight's buzz conversation, first and foremost, again, I want to make sure that everyone realizes and knows that your comments are very critical. They're very important to us. We want to make sure, and you guys have been doing it, you have been sending in those comments, and we appreciate you. We appreciate all of the comments that you guys send us. So, and again, nothing less than that. The comments are strong and powerful. The likes are as well. And we want you to continue sharing. Please share because it's so critical. We want this to go everywhere. Like I said before, I speak it into existence that this will go all over the U.S. because it's stuff that people want to hear about. They're telling us that they like the contents.
That's right. Important topics that people talk about every day.
That's right.
Yeah. And that's what we do. Just talk about it.
That's right. And a lot of it is our opinions, and a lot of it we actually do research. So it's again, it's things that we just want to put out there for everyone to be aware about. And I was telling them today is about awareness. It's totally about awareness. And also our conversation is a conversation that needs to have been had. This is something that should have been spoken about a long time ago. And we're finding out a lot of this information. So as we find it out, we want to make sure that you all find this information as well.
Yes. Because a lot of people don't even know it exists.
They don't know it exists.
Yes.
So with that being said, April is the month of Black Maternal Health Month.
Yes.
And actually in the month of April, the week rather of April the 11th through the 17th is actually for Black Maternal Week specifically. And they actually had a call to action in Washington. And the call to action was regarding disparities on Black moms and their babies.
That's right.
So it was very critical stuff that was needed for a lot of people. And as we get into this deeper, you will realize some of the things that even myself, I'm finding out a lot of this stuff.
Yeah.
So it's very critical information, but it's information that needed to be talked about. So with that being said, our buzz conversation for today is Black maternal health.
Yes, yes.
And
Which is
Black,
very important.
very important.
Mm-hmm.
Black women are 3 times as likely to be, Black women are 3 times as likely to die
Mm-hmm.
from pregnancy or childbirth. Yes,
Right.
it's exactly what I said. To die, 3 times likely. Specifically in the state of Texas, where that is one of the worst ones in our entire country, and
Yes.
some of our southern states, but just states throughout.
Yes.
What do you think? What do you
Yes.
think about
I
that?
think that being a nurse myself, I didn't even know that all of this existed because my field was mental health / infectious disease. My last tour was infectious disease manager.
Mm-hmm.
And I was surprised when I went to the Black Caucus last year that they actually talked about Black women in labor and not making it out, and the babies dying, and that a lot of it has to do with racism. I was like, are you kidding me? I mean, I listened, and because I had never heard that. And working in an interstate hospital myself, you know, doing infectious disease, I did cover the whole hospital at times on the weekend. And I never heard about anything like that. So this is an enlightenment as well for myself in regards to this. But you're absolutely right. Women in the US are 2 to 3 times more likely to die than Canadian women in the maternal period, which starts at pregnancy to 1 year after delivery or termination. And infants in the US have a 76% higher risk of death compared with infants in other wealthy nations. And Black women, Afro-American women, drive the US mortality rate. The reason why it's so high is because we as Black women drive it. We're not getting the care that we need. I mean, and this is 2025. Can you believe this?
Exactly. And I'm telling you, it was so surprising to me because of just what you said. We're in a current time of 2025, and these things are happening.
Yes.
Because as I was saying, the healthcare system is basically failing our Black women, totally failing them. I remember doing a little bit of research. The Congresswoman Jasmine Crockett, who represents, she's wonderful, she represents Texas. And she was doing an interview with this woman. Her name was Thana Hickman. She is actually the founder of Viola's House. Now you ask the question, what is Viola's House? Viola's House is a home where they actually help the teen moms with maternity, and they help their babies as well with disparities and issues with Black moms. Some of these issues are like the food insecurities, housing, education, and many more things. But what they do is they have these women there, and they're there to guide them through the process of their entire pregnancy. So they're there to help them along the way, and they're helping them for their health within the community. So it could be with the doctor's appointments. It's just various things, but they help them all the way throughout this pregnancy until they deliver their babies to make sure that they have a well delivered pregnancy.
Yes, yes. And I'm sure that helps them talk about, you know, things that are bothering them if they have certain symptoms and stuff.
Yes.
To let the doctor know and really express their feelings, because a lot of times a physician may not know. And so they're you know, taking care of the patient, but a lot of the times the patient is not verbalizing what their body feel like. And only you as the patient knows your body.
That's right.
No matter what a doctor say, no matter what anybody say, you know your body. And you know when your body doesn't feel right. And it's important that that be verbalized immediately when you're feeling something, especially, you know, you're carrying a life inside of you. That's extremely important. I just want to mention that the maternity mortality rate is considered the number of maternal death per thousand, per 100,000 live births annually. And the infant mortality rate is 1,000 live births annually. So the U.S. mortality rate do not compare favorably with other countries. Other countries are so ahead of us in regards to bringing forth a live baby and the mom surviving. But the difference with this, is that the disaggregating data by maternal race reveals a different picture. By race now, okay? And the maternity mortality rate of white women and their children in the US are close to national average. Okay? Whereas the Afro-American women are closer to national average of countries with less developed economy.
Wow.
So poor countries, our rate as a Black woman compared to poor country, where our white women's rate is at national average.
Yes.
So it is us that is bringing down our mortality rate in the United States.
Isn't that is so sad. That is so sad.
Isn't that something?
It is.
And
but
we are the most country that have more money, more everything.
Yes.
We're supposed to be the top of the line, but our babies and our pregnant moms are dying.
Are dying because of the health system. Yes. And with that being said, these conversations are never talked about within the news. They're never. Because as you said and I said, these are things that I didn't even know about. But as we did the research, and as you said, you went to the caucus, you saw it. And I was like, wow, this is crazy in 2025. Yes. But these are real things that happen. And people need to know about it because it's very sad. It's very sad. Yeah. But in saying that, going back to speaking about Fauna, the young lady that actually found Viola's house, the question was asked to her, why are these Black women dying during this time? Yes. So and this was her statement. She stated the healthcare system is rooted in racism, bias training. And that's what she said. She said that our Black women are being told that they complain too much. That when we have pain, we can handle the pain. Isn't that sad? We're not being heard. They don't want to hear us. They just want to do what they want to do. So they're putting us and they're shoving us to the back. Yeah. And a lot of us, the Black women, we have to learn to do our own research. Yes. So we got to get educated. Yes. We got to get on our feet and know what we got to do. We got to get educated and do our research when it comes to these hospitals and look at the ones that have the least amount of maternal deaths and make sure that you do not go to that hospital. Right. You got to ask those questions if you're having some difficulties and you know things don't feel right. Look at it and say, well, can I have an EKG? Yes. Can I have an X-ray? These are the things that we, as the women, the Black women, we have to be educated on doing that because you may not know everything. That's right. But if you know something that's wrong, ask some questions. Advocate for yourself.
That's true. That's true. That's extremely important. The way that I have seen it in healthcare myself, and I can give you an example of what happened to me when I covered in my hospital. I was covering one weekend, and I was covering L&D, which is labor and delivery, and medicine and maternal child. And I was doing my rounds, and I was called by L&D. Now I'm a infectious disease nurse manager, so I was called to go down there. They were having a problem, so I go down and I say to the nurses, "Well, what's going on?" And they said to me, "Well, we have a patient here who won't open her legs." I said, "What are you talking about? This is, she's in labor." I know, Miss Jackie, but she won't open her legs." So as I entered the room, she was a young woman, probably 19 or 20, whatever, and she had her two friends there. And they were just giggling and laughing, and I'm looking and I'm saying, well, saying to myself, why are these friends here? Because that was a distraction.
Right.
Okay. We do allow, every hospital allow you to have a support person. When I had my child, my husband was there. When you had George, your husband was there.
That's right.
To be in there with you. But she had two young ladies that were her friends. And they had the camera going and they're taking pictures, and the doctor's standing there because, she's not letting him do what he needs to do, which was to examine her and everything. And she was in labor. So I said, well, and I looked at her, I said, well, you need to let her friends go. Well, I said, but this is the problem. She's young. She's just acting out right now. Trying to be brave and everything. Oh, but she needs to be examined. This baby is coming. So I go in. And I say, what's going on? Oh, hi, blah, blah, blah. So I say to her friends, why are you here? Well, we're here to, I said, listen, right now we're having a problem and you need to leave this room and go in the waiting area. But I want to take pictures, no more pictures. I said, enough is enough. Right. No more pictures, you want to go. And they were about 18, 19 or 20 years old. You need to go in the waiting room. The doctor was standing there, wasn't saying anything. And I'm saying to myself, he should have more control.
Exactly.
He's the physician. And his patient is in labor. So I had to come in. So I said to the young lady on the table, I said, listen, the doctor needs to examine you. You're in labor. And he's saying that you'll probably have this baby in a few minutes. Oh, I don't want to open my legs. It'll hurt. And so I whispered in her ear, Lord have mercy. I whispered in her ear. I said, let me tell you something. I said, this baby is coming, whether you want it to or not. I said, because that is the way it works. I said, so he needs to make sure that he's guiding the baby out so the baby lives and you live. I said, this is dangerous. I said, but not only that, baby. I said, let me explain something to you. I said, if you don't open your legs and let that baby come out, I said, guess what? You're going to be split from one way to the other.
Oh my God.
Oh my God.
So you had to make her come to her senses.
Something that's scary, oh my God. Okay.
Jesus.
He said, okay. She said to me, can you please stay here with me? I looked at her because she was an Afro-American young lady. I said, I'll stay here with you. So I said to the nurses, I'll stay here with you. So I paged my other coworker that was with me that day she was covering critical care. I said, listen, I'm gonna stay here with this young lady. I said, because she don't know what she's doing. I said, they're having problems down here. So I stayed with her until she delivered her baby. And I'm saying to myself, it just seemed to me after I left that the physician should have had more control.
Right.
The physician should have said, that's it. Nurses, I want these people out of here and call security or whatever the case may be. And you're the patient, you need to open up because the baby was in danger.
Right.
And so was his patient. He had two people there that was in danger. And thank God I came down and I talked to her. I had to talk a different way to her because she was young.
Yes.
And her vocabulary wasn't the best. And she was really acting out because the young girls was there. So once I got rid of them, then she became what she should have been, more acceptable and things like that. But I say that if I had not come in and did what I did, I don't know if that baby would have survived or her.
Right.
Because as soon as they left and I was with her, that baby came.
That baby came. Wow.
And I was helping her grieve. And I'm saying to myself, all of this time, you know, I would think, like I said, there should have been more control there.
Yes.
But she was not as acceptable to what was going on. And but someone needed to take control. So there are different aspects. What I'm seeing is different aspects of things that do happen in the L&D room, and that was one example. It doesn't happen all the time, but that was one example. And social economically, she came from a very poor family. So I'm not sure if, you know, and her language, like I said, wasn't the best. So I'm not sure if that was a deterrent for the people that were taking care of her or what. I'm just thankful that I was there, and I had to come down to, I had to talk to her in a way that she understood what I was saying, you know. Whereas someone else would have been a different type of language I would have said to them. But I had to make it very clear to her, to a language at her level, that she understood.
Right. But the sad part of all of that, just what you're saying, you had to do it at her level, even though you had to step in to do that. If you weren't there, like you said, what would have happened? Now, I don't know if was the, you know, who the doctor was, and if it seemed to me as if he just didn't know what to do at that point in time.
He was standing back looking.
Yeah, but I just feel that as, you know, being a medical, you know, physician, he should have had a little bit more common sense when it came to that too. Because you're dealing with, first and foremost, you're dealing with a young person. And then also, you know, you don't know if she's truly understanding everything that's taking place. So the way he would have dealt with her, would he have dealt with other people in the same manner? That's what makes me wonder about that.
I don't know. But I do know that as a physician, he could have had more control because he had 2 lives that he had to consider, that should have been considered. And he had the control to say to the nurses, get security here. You know, take these young ladies out, because once her friends were gone, then, you know, she was more cooperative in doing what was needed to be done. You know, she was showing off, they were taking pictures and all kind of crazy stuff was going on. And
it was just a blessing you were there.
She was in active labor. So I think it's an educational component as well for physicians, as well, is that they also have to be educated about different cultures. Because she came from a different culture. I knew that when I first walked in and started talking to her. I said, oh God, you know, I said to myself, because she came from a different culture. And so you have to handle things a little bit different. But just the fact that you had 2 lives in your hand gives you the authority to shut things down.
Right. And with that being said too, that's why they say meet people where they are. And that is something that he, as a physician, should have been able to do.
Right.
As you were able to detect what was necessary and needed, he should have been able to do that as well.
Right. Many times that, you know, training is needed. Training is absolutely needed.
Bias training again.
Yes. I can tell you so much. Even when I had my own baby, my second one, my first one, Delilah, I had no problem. I had her naturally. But my son, I was having grave difficulty with him. And my doctor, wonderful man, he was on his way. And so I had the residents that were coming in. I was extreme pain, excruciating pain. And I said, I'm in pain. And so they said, well, we can give you a block, you know, in your back. And so I said, no, I don't want that. So I was tossing and turning, but I could feel the sparks going off in my body. And the nurse looked at me and she went out. And as she went out, my doctor was coming. And let me tell you, when he walked through that door, he was cursing.
Yes.
and yelling at those residents, what the blah, 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 are you doing? Da, 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 da. You know what you're supposed to be doing. And he went off on them, and I was like looking at him, but he went off on them because he knew whether I said yes or no, my life and my son's life was in danger at that time because he was smart. And I was saying, doctor, and I'm not going to mention his name. I said, I'm in so pain. I'm in so much pain. You got to help me. He said, Jackie, I will. And calm down, calm down. And then he said, he told the nurse what to give me. And I just leaned on her and she gave it to me. And I had to end up having an emergency C-section. Because he said the baby's, he said, you're 9 centimeters, but the baby's not coming. And the baby's in distress and you're in distress because what? And he was so angry. He's a Jewish doctor. I had known him for years because we had talked a lot together and being in the health field, and he knew that. And I went to him when I was in my early 20s, so he knew me very well. And afterwards, he said he made them stay. He made one stay with me all day long. He said, I don't care. You're gonna sit right here with her, and you're gonna document everything. He was so mad, and he was cursing at the residents. He said, what in the world are you doing? You know what you're supposed to be doing. Blah, 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 blah. He went off. You don't treat my patient like that. He went off. But that could have been a different situation.
For sure.
I was right there. You know?
And this with that, with you saying that, something similar happened to me with Christian, the youngest one. Everything we thought was going well, and then things turned. It just turned around. Because my doctor had actually went out. He was going to dinner or lunch or whatever he was going to do. And he knew that, things was good. He said, when I get back, it'll be time. You'll be ready to go and have the baby. But I had always explained to them, I'm not the normal. I'm the one that when I have, as soon as I go into, oh my goodness, I can't even think of it. When you start to have the baby. Labor. Yes, when I start to go to labor, I'm going to have the baby that day. I'm going to actually have the baby that day. Some people will go hours and hours and hours, but this was my third. So he was going to come pretty quickly. But what happened, they ran into complications. And when they ran into complications, it turned around, but they got me out quickly. And I didn't even know that they were sending me into surgery, emergency surgery. But Harry was right there. And they explained to him, not telling me anything, that they had to do this surgery. And, and I was being wheeled in. And when I got there, they were like, can you feel this? Because they were getting ready to inject. And I said, yes. Because he said, I'm sorry, if you can feel it or if you can't feel it, we have to cut you now. He said, just think of it as a life and death between you and your son. But if my husband wasn't there to advocate for me, who would have known? It could have went in a different direction. It could have. Because it was happening so quickly. And things just was not looking good.
Right.
But to God's glory, everything changed. And it turned out.
But I think also you had the same doctor for your children, and you had a good rapport, and so did Harry. Harry had a good rapport with him, and you asked a lot of significant questions during your pregnancy, which makes a difference because a lot of people, I find, would just go along with what the doctor say. And and I used to say, listen, I don't like to have a lot of pain. I'll tell you that right now. And I need this and I need that. So I even tell my doctors now what to order. I need this. And this is all right, Jackie. Well, what and this and that. Now, what you ordering me? And
that's
what
right. You want to know?
They be like looking at me, but I don't care.
I do the same.
My body. That's my body.
And
and I'm a human being.
Yes,
and
that is for anything. That is for any doctor that you see. Be your biggest advocate for yourself. And if you can't do it, have somebody come with you that can help you, because maybe you're not able to do it, but at least have somebody there that can do it for you, at least, because then they start to look at you a little differently. And they realize that, oh, I can't just do anything with this patient because she understands. She's a little more educated on what's happening with her body. Ask those questions, even if it may not be in your mind the right question to ask. You're asking something, and they know that you were a little bit up on it. So
That's
ask
right.
those questions.
That's right. That's right. And what they
Don't be
have
afraid.
found, yeah, can you hear me? I know what
Yes.
they have found is that in some of the research that I was reading was that Afro-American women, many comes from poor economical areas, and the type of food that we eat. A lot of us have hypertension. Many of us can't afford good health insurance. So all of those risk factors that sort of set in for Afro-American women are there. However, what they found is that when they did a comparison, that it wasn't the risk factors that caused the mortality rate for women, for Black women, and for the babies. There was another factor, and the other factor was racism.
Yes.
Not race, but racism.
Racism.
And they said that is what played, according to the research, that is what played a lot of significant factors in regards to the care that the mother was receiving. Yeah. And I know you mentioned about this, this young woman and everything.
Yeah, Sana.
But what they were saying is that even with, I don't know if you mentioned Serena, the tennis player, what had happened to her, and she had money, and I'm sure she had one of the best hospitals that she went to, as well as her doctor. But when she started to complain of the issues that she was having, I think it was chest pains or something like that that she was having, no one paid attention to her. And it's because I think I mentioned this before when I was at Spotswood, and we talked about depression, and I did a little speech on depression, that Black women in this country, it's a lot of biases towards us in regards that Black women are strong, we can handle anything, and that goes down from generations to generations. And therefore, because with that, we don't, our pain level, we can tolerate a lot of pain and all this craziness that has carried from generation to generation. So when you're in the hospital and you mentioned about pain and you start to complain of pain, then what you hear is, oh, she's not in that much pain, it's not that pain. She says she pain, but she can tolerate it, she's not in pain. And then sometimes as Black women, we try to be strong. Right. We try to deny it. I'm not in that much. I can take it. I can take it. Instead of saying, no, I can't. I'm in pain and I need medication like everybody else. That's right. You know what I mean? I can't take this. But we're so caught up in that facade that has come down from generations that you have to be a strong Black woman. And if you're not, there's strong and brave with you and all this kind of stuff. And depression, we're not supposed to get depressed. So we don't talk about depression to our physicians and stuff. And so all of that stress and everything plays a part on our body that is like covered. So when you go to have a baby and everything, you're not just having that baby, you got stress and everything compounded on top of you, and then the racism that's there as well, because you feel that it's there, but yet you got to be strong. All of that can cause an increase in mortality rate. Yes. And can affect our babies as well, dying. Yes. And also, once we've had the babies, the postpartum area is very critical, where they ignore our symptoms again, because we're telling them that we're going through these issues, and they're looking at us just as you said, oh, they're just saying that, or whatever they're thinking, but they're ignoring it. And when they do that, it causes problems. It's causing it because at that postpartum time, this is when a lot of times critical issues will occur. That's right. Especially heart problems. Yes. That is one of the biggest ones. They said that the postpartum will come in
and you'll have a heart problem of some sort, and that's when we lose our lives.
Yes, yes, because having a baby is very stress on your body. I mean, your heart beats faster, your muscles in your body, everything is working,
Yes.
okay, to deliver this baby. And it puts stress on your heart because you're pushing and all of that. All of that is working, you know, against your body. And so you have to really, after having a baby, rest, take care of yourself. You know, if you're having any type of chest pains or any discomfort, you need to let the doctor know, because your body have been through 100% stress on every organ in your body, from your lungs to your heart to your kidneys to everything has gone through stress. You've had a baby, you know, another person, you know, and that makes a big, huge difference.
It does. It really, really does. And also, there are people that can help, especially for our Black and brown women, you know, because of the factors of the disparities and the issues that are out there. And these people are called doulas and midwives. These are people that are very helpful during labor and postpartum, especially during the postpartum part, because this is when, as I said, issues will occur. They can help you to advocate to, you know, to the healthcare people. If you're not able to do it yourself, they will be right there to help you along the way. So as Black women, we need to try and connect in with some of these doulas and midwives rather, as they will be there for you even throughout your pregnancies. Because I believe it was stated that they will stay as you're going to labor, beginning of labor. They'll stay right up to the very beginning and go with you all the way up into the hospital.
Yes.
And help with the delivery as well.
Yes.
So if we need to make sure that you need somebody, if you're the only one there yourself and you don't have anybody to advocate, know that you can reach out to them, because they will definitely advocate for you. And a lot of these providers are helping with these doulas and midwives because they realize there's disparities and different issues, especially with the Black and brown women. And they're asking you to reach out for that program, and that program will be something that will be helpful for you, because again, they help to provide emotional and physical support to the mother and can also educate her as well.
Yes. Yes. Yeah. They also said that, you know, studies have shown that Afro-American women, even if they access prenatal care along the way, it tends to be of lower quality than of the women, you know, of white women with the same complications. You know, it's lower quality. Like your health history, stress, and experience of racism contributes to maternal and infant mortality, which we do know that. And what happens is that a younger Afro-American woman, like if they're in their teens or 19 or 20, they have sometimes better outcomes of labor and live births than an older Black woman, because according to the studies that Black people in our country, you know, we have a habit of, because of economics, always have been economics, unable to buy the foods that we need to be more healthy. So we grow up eating foods that are not as healthy, that are high, that can cause cholesterol, that can cause hypertension, where we can be obese. So we eat food that is not good for our bodies. So we've been doing this from childhood all the way up. But the problem with that occurs with a young Afro-American woman, and she gets pregnant, she doesn't have a lot of that has built up because she is younger, okay? But as you get into your 30s and you have a baby, where you have all of these years that of eating improperly, and and the stress on your body, and the racism that you run into, and all of that is outside of your environment, weighs on your body.
Right.
Whereas a young person, it doesn't weigh as much because they've just got into it. You follow what I'm saying?
Yes, yes.
20 years. So they haven't had all of that experience. But as you get older in your 30s, your body has had all of that, from eating the wrong type of food, from a work environment where people are not as kind to you, or there's racism that exists, of stress of even leaving your home. All of that kind of stuff just builds up on you. So then you have a baby, okay? So you're coming into this situation with negativeness already.
Right.
Okay.
Right.
So then when you come into it and you're working with your doctor, and if they're not doing what they need to do, or even if your health insurance is not as adequate as it should be compared to a white person, well, you're not going to get the care that you need. You're already behind the 8 ball.
You're behind it. Yep.
So we need to start taking better care of ourselves. We need to start asking, as you said, the right questions, to the doctor, holding them accountable.
That's right. Right.
Holding them accountable to what's going on with your body, and holding the other healthcare team workers there too, including the nurses. They're there. They know what's supposed to be and what not supposed to be. Holding them accountable.
For sure. And I also feel that regarding the postpartum issues, we as people in general, we need to fight for a policy change regarding that.
Yes.
We definitely do, because there is a need. There is a need, and we have to go out. You have to go and reach out to your representatives, send those letters. It goes up the chain. So when you start sending those letters and informing them of, these are the issues that's happening in our community, these are the things that needs to be done, because they want to be voted back in. They want to be voted back in. So get on board, start writing your letters, sending them out to your representatives. Let them know that there's power in what you're speaking by sending those letters. And you come as a group and let them know, we're not going to stand for this, because these people need help. There is a need. There is a need. And in order for the need to happen, you guys got to get on board and do something and give us a policy change when it comes to this, because it is definitely a need. Yes. And it is definitely something that can be changed.
Yes. Yes, you're absolutely right. The healthcare institution have to take a better look at what's going on in their institution. They have to make sure that they have bias training among their staff, as well as the physicians.
Yes, for sure.
Control a lot. They're the ones that write the orders. They're the ones that write the medications and all that kind of stuff. The hospital has to hold them accountable.
Yes.
I heard I was reading one article where a mother said that she frequently reported that medical staff did not take her pain seriously. That she was having pain, and they didn't really, listen to where her pain was or what was going on. Right. So it's important that all of that get done, and they have to do studies when these things come up in hospitals. They need to do a study to see what's going on, how did it happen, what can we do to prevent it from occurring again.
That's right.
That's extremely important. When things fall to the left, what happened? And they can't cover it up. If it's racism, it's racism.
That's right.
It's as simple as that. And someone has to be held accountable.
Yes.
Have to be held accountable. I say that because here in Virginia, and I'm going to bring this up, although it relates sort of to it, and then maybe not as much because we're talking about mortality rate. But in one of our hospitals here, and it went national, that a nurse was taking care, I think it was intermediate care of little infants. and she was breaking their bones. And they were black babies.
Oh my goodness.
And of course she was a white nurse. And they found, and a lot of babies, you know, the mothers were taking them home, and then they had to bring them back, and found out that their arms were broken, or leg were broken, something like that. And finally they caught up with her. And I'm saying to myself, what in the world? Either she got a mental disorder or racism. They were all black babies.
Wow.
She was taking care, intensive care nurse.
That's awful.
Taking care of them and breaking their bones. Little babies.
And telling that story too, this was one that I had read about, where this particular woman had came into the hospital. She was pregnant and she came in. She came in to deliver her baby. And when she got there, she was having chest pain. And they said to her, they chalked it up that she was just having a panic attack.
Yes.
That's what they said, a panic attack. Well, the woman ended up having the baby and she died. She had a heart attack.
She was having a heart attack. You see?
Yeah.
You
And
see?
that is sad. That is very sad. They never looked at doing a chest x-ray, EKG, none of those things. But because she complained, they chalked it up as a panic attack, and the woman had a heart attack.
And the woman was having a heart attack. You see that?
And her husband was so sad by it, because now he's left with this newborn baby, and his wife is gone,
which could have been prevented. Yeah.
And that was very sad.
Yeah.
Very sad.
So what needs to happen is that researchers and practitioners, and especially the hospital, they need to conduct research studies.
Yes.
They need to conduct comprehensive nationwide data collection.
Yes.
They need to produce data sets that include information on social and environmental risk factors for women and infants of color. They need to conduct better assessment and analysis on the impact of overt and covert racism, you know, on toxic stress and pregnancy-related outcomes. They need to, for these residents and for the doctors, they need to be serious, because the mortality rate for pregnant women and for babies is extremely high in this country. And this is 2025, one of the most richest countries in the world. And it should not be. If we have to look at other countries and see what they do, then we need to do that. But we need to take this seriously, do studies, identify best practices and effective interventions, as well as health outcomes before and during pregnancy.
Yes.
That's what they really need to take serious and need to do. And they also need to hold these insurance companies accountable. Insurance companies make buku bucks.
Yes.
They make money. They make a lot of money. And there is no reason why, if you have insurance and you are a Afro-American woman, that you can't go in and have the best care without having to constantly complain and get frustrated and stressed. Being pregnant itself is a stress.
That's right.
And then you have to go and do that. I mean, it's just too much. It's too much. And but my biggest fear, my biggest fear now is that when Biden and Harris was in office, they had started to put certain things in place.
Right.
They were able to identify that there are disparities among Afro-American women, pregnant women, and babies as far as racism and death in this area. So they were actually placing money there for these researchers and things like that, and to make sure that things happen. But now we have a different president, and you know, he's very controlling, I just use that word, in regards to money, which means a lot of hospitals have already complained that they're not getting the money. And I'm talking about hospitals, not a lot of private hospitals, but hospitals that take in a lot of indigent people, that take in a lot of people that don't have money. We don't have those many hospitals throughout the country. But I worked for a hospital that did have that in New Jersey. And we did get a lot of money from the government in regards to taking care of people that were uninsured. But you have to. If you don't take care of this, then people are going to die. Diseases are going to spread, you know, out of control. So these are some of the things I know they said in the news that, you know, they're very upset over because some of the healthcare stuff has been cut. Finance has been cut. But
And that
research
just makes it
is
bad.
very important in this situation.
Yeah, and that in itself, by them cutting it, you know this is going to push this back even further.
Yeah.
So I would say again, just some ways to reduce the Black maternal mortality being that we need to be a little bit more educated.
Yes.
For sure.
Yes.
And advocate for yourself. Like I said, if you can't do it, make sure that you have somebody there that can advocate for you, because it's going to be critical, and you may have a situation where you can't advocate for yourself. You may be in extreme pain, whatever it may be. But if you have somebody there that is advocating for you, and I say to them, do not be afraid to speak up. No. Stay and do what's necessary and what's needed for your loved one. Because other people do that. We got to look at it and be able to do the same thing.
Yes.
And not hold anything back, because that's your loved one. And you don't know, because you could have them one day coming in there and it may turn a different way and you may not have them. So you better be mindful of these situations and start getting educated on these pregnancies. Because one thing Thana did say, she said, as a Black woman and you become pregnant in the USA, you better realize it's pregnancy or death.
Yes.
That's what she said. Yes. And I was like, wow, she was straightforward, but she was spot on with everything that she said. A lot of people may not want to hear it, but it's reality. It's not in the news. Like I said, they're not broadcasting these type of things because of the disparities and all of that's happening with our Black women. But we have to be able to put it out. Yes. And like I said, when we have conversations, as I call them, buzz conversations, these are things that are needed to be spoken about.
Yes.
These are things that we are bringing awareness to you all.
Yes.
So I hope that this is something that's being very helpful, because a lot of us may be older, yes, but you still may have a family member that is your grandchild, your child, your friend, your neighbor, your cousin, your friend, whoever. We got to be for each other. Yes. And make sure that the information gets spread out there so that we understand it and understand it well.
Yeah, that's exactly true. And I think the starting base is that when you do become pregnant, choose a doctor that you know that you can talk to. Interview. There's nothing wrong with interviewing the doctor, saying, listen, if I start to have this, I need for you to understand this is my body and I'm having problems. And I expect you to react to it in a way that's going to prevent me from dying and my baby. You got to have that report, and you have to interview your physician. And some people may not want to do that, but that's important. I don't want somebody that I can't talk to that, you know, that is not going to understand that this is my body. And if I feel something, I'm going to express it. And I expect you and I to talk about it and come up with a solution, one that's going to be preventable, you know, because this is my life. And working together to reduce Black maternity mortality rate, pregnant women and their family can, like I said, talk to the healthcare provider. If anything doesn't feel right or is concerning, you need to talk. Know and seek immediate care if you're experiencing certain symptoms like severe headaches, extreme swelling of your hands or feet, trouble breathing, heavy vaginal bleeding or discharge, overwhelming tiredness, and more. These symptoms could indicate a potential for life-threatening complications. And make sure that you're expressing that to him. You know, share recent pregnancy history during each medical care visit, and connect with health care and social support systems before, during, and after pregnancy. After pregnancy is just as important.
That's right. That postpartum. Yes, it is. Yes, and they need to make sure when it comes to that health care that we should be able to have that extended out more.
Yes.
For the postpartum, because that's when issues occur.
Yes.
And give them that extra time within the healthcare portion of it, because it's necessary.
Yes.
It's very critical, because like I said, that's when things occur.
That's right. That's right.
Yes.
And
So I think,
and the hospital itself should, like I said, make sure you have standardized coordination of care and respond to emergencies,
right,
making sure of what's going on, improve delivery of care for your patients, you know, and train obstetric care providers, train them. And make sure that you're training the nurses as well. The nurses many times see more than what the doctors see, because they spend more time with the patients.
That's right. That's right.
Spend more time with the patients, and they have to be trained to make sure that what they see, that they can verbalize it. And if the doctor ain't listening to you, then you need to take it somewhere else.
That's right.
Because that person's life is in your hands. And when I was a nurse manager, I would tell them, I don't care what Dr. So-and-so said. What did you see? Well, I saw this and that. Who did you tell? Well, I didn't know. You can tell somebody. Call the chief resident. Call so-and-so.
That's right.
The attendant. Let them know what is going on, because this is what you were trained to do, hired to do. You know, the doctors many times don't have the final say. If you see something different, you have the right to go somewhere else and report it.
That's right.
And then you've done your job. You know, because that person's life at all times is in your hands.
That's right. And I agree with you when it comes to that, because I know even when I was in the hospital last year, I had a great rapport with the nurses and the doctors as well, but you only see them every now and then. You know, they just coming in and they're going to be there a few moments when those nurses are coming back and forth. So like you said, if it's something that you know is not right with your body, don't sit back and not speak on it. Make sure that you let them know that, you know, this is happening to me. I am having those severe headaches. I look at my feet, my hands, it's starting to swell. What's going on? Let's get it checked out. I'm starting to have some trouble with the breathing.
That's right.
All of that. You could be having vagina bleeding and discharge. These are things you better bring it to somebody's attention, or you may be not here.
That's right.
So you got to be very, very, you know, mindful of the things that's going on. And like I said, don't be afraid if you feel something that's concerning to you within your body. Don't be afraid to speak out on it. And if you are, tell whoever you're with, that the person that's there with you, and they can go out and speak for you.
That's right.
They can advocate for you if you're not able to do it. But please, I encourage you again to get educated on these pregnancies, though, and make sure that you pick a hospital. Check your resources. Pick a hospital that you know has a low rate when it comes to mortality.
Yes.
Because you don't want a dead baby or yourself to die from something that should not be occurring in 2025.
That's right. That's easy to prevent it. To be
very easy. Very easy.
But I'm not sure if this, like I was saying, in regards to money that the government gave, I'm not sure if this administration is going to hold up where Biden and Harris had actually started putting money into the, you know, the different healthcare and providing programs to increase you know, to increase better birth rates and less deaths for pregnant women, as well as you know, newborns. But it's essential, because we're the lowest. We're the lowest in the world in regards to, the mortality rate. All the other rich countries, they don't have a lot of mortality rates like we do. They just don't. And in order for this country to be the best that it can be, it has to do better when it comes to brown people. And that itself, because we're the ones that's being treated terribly, and we're the ones that's bringing down the mortality. We're increasing the mortality rate because of racism, biases, not understanding the culture. Of Black women. And it's important that be understood. Other cultures, even other cultures, have better mortality rates than we do, and that's sad.
Yes. Well, I think that this has been a wonderful, wonderful conversation. It's been nothing but awareness, and like I said, things that needed to be said. So I hope that you all enjoyed in hearing it. And a lot of you may have been shocked by a lot of it, as well as myself, until I did more research on it. But these are things, again, that needs to be spoken about. So again, we appreciate you all in coming in, and we will bring forth more and more information, and we'll have some good days on just having some fun time and reminiscing. But we're going to have our awareness times as well, because it's critical, especially in this country, and especially at this time, because there's so much that's going on, and people need to be aware.
Yes. And if you have anyone that you know that's pregnant, spread the word. Express to them how important it is to verbalize their feelings, get to know their bodies, do some research if you're in your early trimester of your pregnancy before you have it, so you know what is normal and what is abnormal, especially if you're a young mother. And talk to your doctor. Bring these topics up. Say, listen, my understanding is that there's a lot of Black women that die in pregnancy, and the babies also, the infants also die. I want to know your feelings about that.
That's right.
The doctor be looking at you, what? And he will remember that. He will remember that when he's delivering your baby, because he know that you know what's happening in the world, and how Black women are dying from birth, from birthing their babies, and their babies are dying, and it doesn't have to be. So bring that awareness, be knowledgeable of what's going on with your body, be knowledgeable of the stages of your pregnancy, and bring that when you're talking to your doctor, and talk to him about it. Let him know that you're intelligent and you know what's happening. And let him know what you've been reading. I heard a lot of Black women, and I don't want to be one of those. I want to know, what do you do? And da-da-da-da-da-da. That conversation is important. It's extremely important, because you have then put him on notice. And make sure that her on notice.
And make sure that we encourage our younger moms to do that as well, because we do have some very young moms, and we want to make sure that they're not just going by every single thing that they hear from the doctor. Let him know that you, like you said, you are intelligent, and that you have knowledge on these situations too. And you don't want just anything to happen to your body. So I'm bringing forth this so you'll know that I am aware of situations. Make sure that happens.
And the other thing that we forgot to mention, if you have a husband, bring him along. Make him knowledgeable too. If you have a boyfriend and you and him have a relationship and he wants to be involved, educate him as well. So that way you stand together when you're talking to this doctor. So he knows that both of you know, if he's going to be in there with you, he needs to be able to have a voice. So education is extremely important for the pregnant mom, as well as the dad.
Yes, I agree. I agree. So with that being said, did you have anything else that you wanted to
No, no. I
discuss?
just hope that it was enlightful to everyone.
Yes, and I do believe that
Because
it
I was
was.
not aware until I went to the Black Caucus
And I wasn't aware.
last year. I was like, "Are you kidding me?"
Yes, I
I
was
couldn't
totally
believe it.
blown.
I thought
Totally
we were
blown.
way ahead of that.
Yes, yes, yes. But that's why we need to make sure that we bring this type of information out to the forefront so people know that this is nothing that that we're hiding. We're trying to bring it forward. We're trying to make awareness. We're trying to make it that everybody knows because like I said, it's not in the news. They're not speaking about it.
Yes,
So somebody has to talk about
that's,
it.
that's right.
And I give all the glory to God for allowing us to be able to do this. He gives us the space and we work it. So I appreciate you being my sister because you always help me with these things as well. So with that being said, I'm just going to leave you with a little something as well. And it is Isaiah 41:10 NIV. So do not fear, for I am with you. Do not be dismayed, for I am your God. I will strengthen you and help you. I will uphold you with my righteousness right hand. To God be the glory.
Yes, indeed.
All right. Have a good and blessed night, everybody.
Yes,
Bye, Jess.
yes. See
Love
you,
you.
honey.
Peace.
Take care. Love
Bye-bye.
you.